All right, today we're jumping into a really complex and honestly a super misunderstood topic, somatoform disorders. Think of it as this mysterious and often pretty painful conversation happening between your mind and your body.
So what happens when the pain is absolutely real, but all the tests come back clear? This is a huge question for so many people. You know you're feeling something, that chronic pain, the exhaustion, stomach problems, but every single doctor's visit, every test tells you you're fine. It's got to be one of the most frustrating and isolating feelings, and that's exactly what we're digging into.
And look, let's get one thing straight right from the get-go. These symptoms are not imaginary. They are real, they are distressing, and for a lot of people, they can be completely disabling. This is not about someone making it all up or being all in your head. No way. The pain is real. The fatigue is real. The mystery we're trying to solve isn't if the symptoms are real, it's why they're happening in the first place.
Okay, so what do we actually call this? There's a formal name for it. In mental health, the big diagnostic manual, the DSM-5, groups these conditions together as somatic symptom and related disorders. Now that's a mouthful, but the main thing to remember is that this is a real, recognized group of conditions, and they all center on this incredibly complex interaction between our mind and our body.
So, here's what we've got on tap. We're going to start with the mind-body mystery itself, looking at symptoms and diagnosis. Then we'll cover the ripple effect. After that, we'll see how modern medicine and yoga can come together for a more integrative path to healing. And finally, we'll talk about your path forward. All right, section 1, symptoms and diagnosis. So what does this all actually feel like for someone going through it? Let's really unpack the experience and figure out how it's diagnosed. Okay, so first up we have what's called somatic symptom disorder. This is where you've got one or more physical symptoms that just won't go away, things like chronic pain, fatigue, stomach issues. But here's the kicker. The disorder isn't just about the symptom itself, it's about the response to it. We're talking about really high anxiety, disproportionate thoughts about it, to the point where it's causing major disruption in your daily life.
Then there's illness anxiety disorder, and this one is different. The main focus here isn't actually on a physical symptom. In fact, symptoms might be really minimal or not even there at all. The real issue is this persistent, nagging fear that you have or are going to get a serious illness. And no matter how many times a doctor tells you you're okay, that reassurance just doesn't stick.
And then you've got conversion disorder. This one can look really alarming because it involves neurological symptoms, things like weakness, paralysis, or even non-epileptic seizures. But here's the thing. When doctors run all the tests, the symptoms just don't line up with any known neurological disease. And very often, you can trace the trigger back to a major psychological stressor or a trauma. So when it comes to diagnosis, you can look at it through two very different lenses. On one hand, you've got modern medicine. It's focused on the DSM-5 criteria, really honing in on the patient's response to their symptoms. They might even use tools like a PHQ-15 survey. But on the other hand, you have yogic psychology. This perspective is totally different. It sees the symptoms as an imbalance in our prana, or our life force, basically a physical sign of unresolved mental fluctuations. Okay, so why does getting a handle on this matter so much? Because this isn't just about feeling a bit off. If it's left unmanaged, it can create this massive ripple effect that touches literally every single part of a person's life. It's absolutely crucial to manage it early. And yeah, those ripples can be pretty serious. We're talking about things like chronic disability and social withdrawal. It can lead to other issues like anxiety or depression. It can trap people in a cycle of frequent, totally unnecessary medical procedures, not to mention the huge economic burden this creates and the strain it puts on that super important relationship you have with your doctor. And this is where we see the real physical toll. The chronic stress from all this isn't just in your head. It can actually dysregulate your body's core systems. We're talking about things like your hormones, your immune system, even your pain sensitivity. It messes with what's called the HPA axis, which is basically your body's central stress control system. So yeah, the impact is very, very real. So, after all that, what can we actually do about it? Well, let's talk about two really powerful toolkits for healing. They're pretty different, but both can make a huge difference. So let's break this down. In the Modern Medicine Corner, the philosophy is what we call biopsychosocial. It's about validating the symptoms and then managing the response to them. The go-to tool is usually cognitive behavioral therapy, or CBT, maybe with antidepressants if needed. The goal? To reframe how you think about your symptoms. Now, on the yoga side, the philosophy is all about restoring that mind-body connection and balancing the nervous system. The tools here are things like asana, which are physical postures, and pranayama, or breathwork, and meditation. The goal here is to get better at listening to your body and regulating your own stress physiology.
But here's a thought. What if it's not an either-or situation? What if you didn't have to choose? It turns out the most effective path forward isn't about picking a side, but about bringing the best of both worlds together.
Yeah, exactly. The most effective approach isn't a choice between medicine and yoga. It's a synthesis. It's about creating this holistic, patient-centered model that really works. It's about treating the whole person, not just a set of symptoms.
So what does that actually look like in practice? Well, here are the steps. Number 1, you need consistent medical care with a provider you trust, someone who validates what you're feeling and doesn't just order more unnecessary tests. 2, you bring in psychotherapy, like CBT, to help reframe those unhelpful beliefs and build coping skills. 3, you add a mind-body practice like yoga to regulate the nervous system directly. And 4, and this is so important, you make sure everyone on your care team is actually talking to each other.
Okay, this brings us to probably the most important part of this whole conversation, your path forward. What does this all mean for you, and when should you actually go and get help?
The guidance here is pretty clear. You should definitely seek a doctor's help if your physical symptoms just aren't going away, if they're getting worse, or if they're interfering with your daily life. It's also time to get help if those symptoms are coming with a ton of health anxiety and emotional distress. And of course, if you experience anything that seems like an acute illness or a major neurological issue, that's a sign to get medical help right away. So, I want to leave you with this final question to think about. After all this, could it be that the future of healing isn't found in treating the mind or the body in isolation, but in really listening to the dialogue between them?